The lateral trochanteric bursa. On the outside of your femur bone here, where the shaft of the femur ends, there's a large bulbous trochanter. The trochanter is where all the musculature connects. It's how a leg moves. So the muscles on the back side, the external rotators, pull the trochanter this way and you turn your leg outward. There's a couple of muscles like glute medius and minimus on the side or upper hip area here that attach to the trochanter and lift the leg laterally, and that's a big one for this condition. And there's a smaller muscle in the front, tensor fascia lata, that tugs upon the iliotibial band from the front side. So you got the glute medius and minimus on the back, tensor fascia lata muscle on the front, and collectively when they fire, they pull upon the iliotibial band. Dorsal sac can get aggravated on the outside, usually because the musculature, those three muscles I mentioned earlier, are firing so often and so strongly, they're developing such a tension state, the iliotibial band begins to pack down on the outside of that trochanter, thereby aggravating the bursal sac that sits between the iliotibial band and the lateral trochanter of the femur. It's a simple problem to fix. One, it's generally very localized pain, so you can palpate all around that trochanter, feel the bursal sac, and the patient will often say, or your loved one will often say, that's where the pain is, it's centered right there. Differentially speaking, we want to make sure that we're not dealing with a low back problem that is referring to that area, but in the event that it's no back pain, no stiffness, no soreness, it's just pain on the outside, you know what you're dealing with. And on this, you're just going to take your fingertips, mostly I use my thumb, and begin to find the most tender spot, and gradually, using sort of a stripping, a little bit of a shiatsu, I'm pressing down, but I'm also stripping across. This is also better done with a bare hand, bare skin massage lotion that allows you to glide over that area. So find something in the bathroom like a cream or a lotion that you have that will allow you to rub the fingers, and you can take the leg, lift it. This will lax the tension state. As I lift the leg, the iliotibial band will lift up and that bursal sac will lie without the compression. So this is actually nice and relieving if you're suffering from this particular problem. And you can get in there and hold that bursal sac in your fingertips like I'm doing and lower the leg down and strip it. So I'm actually lowering the leg down while I strip my fingers up, and it's a nice stripping effect. So we're basically going to take that and we're going to aggravate a little bit. We're going to get in there and kind of make it sore. And what you'll find is it'll go from a sharp grabbing pain where you're using it in a day or so to a dull pain. You do it again, and within a week or so, usually a few visits or a few treatments, you can take that bursal sac and get under control quite easily.